Good morning, everybody. It's Sunday, September 19th, 2021, and I'm going to give the COVID-19 update for Lake County. I'm Gary Pace, working on an interim basis as the public health officer for Lake, and I've actually transitioned to other work, but I'm part of a group that is helping to work in this role while a permanent solution is found. So you'll see me and Dr. Evans and probably other people off and on trying to help fill this role for now while they're trying to get a permanent person for it. Unfortunately, I won't be able to be in the Board of Supervisors meeting this week, and Sarah is on vacation. So we're going to do update on this video now that'll be shown over social media, I believe. We will have some community partners that work with the Latino and the Native communities sharing their perspective during the Board of Supervisors meeting on Tuesday morning. So I'd like to go through Sarah's slides now. So Sam, if you could put those up. Great. So this is the percentage of people in Lake County that have been vaccinated. And so basically at this point, 1 in 3 eligible Lake County residents are currently unvaccinated. So, and if you look at the statistics there of the racial breakdown, 70% of Native Americans in the county are fully vaccinated. 57% of the Latino folks are fully vaccinated. 54% of the white non-Hispanic population is vaccinated. And this leaves about 18,000 people who qualify, who are currently not vaccinated, which is, as you can imagine, a very big field that a big field of vulnerable people that COVID could rip through as it comes through. Next slide, please. So this is the testing data, and it basically shows that things are similar as before. The number of tests have dropped a little bit. The testing positivity is up a little bit from the week before, but the general trend seems to be about the same right now. Next slide, please. This is the case rate in Lake County. Lake County is the red, and you can see in the last week, it looks like a slight bump up. We don't really know whether that's going to be part of a longer surge or whether that's just a small data glitch over the last week or so. The green is the Northern California counties, Mendocino and further north, and that is, as you can see, is higher than us now. It is also, we're following the same general trend, which is a general drop with a little bit of a bump upwards in the last week or so. Still remains to be seen what exactly is going on there. Next slide, please. This is the epi curve that we look at each week, and you can see we're still, the case rate is still quite a bit higher than it's been for most of the pandemic, but it does seem to be generally declining from where it was at its peak several weeks ago. I'm sure the current week is going to be higher than last week, and that's not too surprising given the fair and all the school activity. But the question is whether this is going to be a gradual upwards climb again, or whether this is just a momentary peak. Next slide, please. So this is the demographics of the cases over the past month, which is kind of interesting. The white non-Hispanic community, it has 2/3 of the cases that we've seen now, and Latino or Hispanic community had 21% of the cases, and then Native Americans had about 2% of the cases. So these are the cases in the past month. Which about reflects the way the population breaks down on its own. So there's not too many surprises there. The part that's the most fascinating is that 87% of the new cases in the past month were unvaccinated, and 65%, so 2/3 of these folks were between 20 and 64 years of age. So this is a different group than we were seeing 6 to 12 months ago, where it was mainly the older folks that were getting sick. Now it's the younger folks in the 20 to 64-year-old range. And you can see the breakdown. 1/3 lived in Clear Lake, 20% lived in Lakeport. And so I think that's good. Go ahead, the next slide, please. So this is the hospitalization rate, and we're seeing a slight drop in hospitalization and also in the ICU rate in the county. And we are definitely seeing pressure in the hospitals, but it's not as bad as it was a few weeks ago, it appears. So this is, again, another sign that things are loosening up a little bit, hopefully, and hopefully it continues to go that way. Next slide, please. So this is the ICU beds that are available. Again, there seems to be a little more availability in the last week or so than there has been in the previous couple of weeks. Next slide, please. So this is the death rate, and unfortunately, this continues to move along. The deaths are the last variable that will drop after a surge. And we can see that last month in August, there were 14 deaths, which was the second highest month since the beginning of the pandemic. And we're now at 5 so far this month, and we're only halfway through the month. So I would expect this to continue to climb. Whether it's going to be more than last month, hopefully not. Hopefully it's not that bad. But and I think that's the last slide. So thank you, Sam, for doing that. And you can go ahead and unshare it now. Thanks. So as you can see, the surge seems to be plateauing. We're not absolutely certain that's true, but it's somewhat reassuring. We have not started to see a significant rise in cases that we were worried about coming from the fair. The next week or so will tell us a lot. And I do continue to worry that as we move into the fall and winter, that we may be looking at a significant spread and severe illness amongst the unvaccinated community, that 18,000 people that are unvaccinated. The vaccinated people, again, what we're seeing is for the most part, people that are vaccinated are being spared from severe illness and death. The ones that are getting sick tend to be people that are very old or have underlying health problems. So this Delta is just really contagious, and it seems to find a way to spread amongst the vulnerable people. Not everybody who gets it is going to get sick that's unvaccinated, but if you are unvaccinated and you get the infection, you run a risk of getting very sick or dying from it. And that's what we're seeing consistently in Lake County, around the state, and around the country. So we now have over 30,000 people in the county that are vaccinated, which is really great, but that still leaves about a third or so of the eligible folks that are not vaccinated. And those are a very vulnerable group. It's sort of like having, an area where the fire, people are not clearing away the underbrush, and the homes at risk because of the burnable fuel. Well, that's kind of the way we can think about this situation with the vaccinations. So the northern counties in California are suffering from a high case rate and hospitalization rate now, and we think that's probably mainly due to the lower vaccination rates than in the rest of the state. Clearly, if we can increase the vaccination rates in our county, we're likely to be able to keep the schools open, keep the businesses functioning, and keep the hospitals from getting overwhelmed when the next surge hits. It looks like what we're seeing here is that things are plateauing, but they're not dropping down completely. And if another surge hits fairly soon, we're going to see these numbers go climbing quite a bit more again. So if you are interested in getting vaccinated, the mobile van is at different sites around the county. You can go on our website to find the schedule. Walk-ins are fine there, so you don't need to go through a complex scheduling process to do that. We also have an ability through the health department to visit a limited number of folks who cannot leave their homes to get their shots. So if you contact us at the health department and let us know your situation, if you fall in that category, we can potentially come out and give you a shot at home. The schools are dealing with a lot of cases now, and it's very disruptive to the learning with the kids because they keep getting sent home if they're positive or they're contact to a positive case. So if your child is 12 or older, we strongly encourage you to go ahead and get them vaccinated. And this is going to help them get a better learning experience and prevent them from getting sick. The parents of school-age kids can really help a lot by getting the shot as well, because oftentimes it seems that the infection comes into the household through the parents from work or some other community event, and then the kid gets sick, and then they go to school and things unfold from there. Also, to protect the hospitals, we want to focus on those most likely to get really sick, and that's the folks over 65 who aren't vaccinated. So if somebody's in your family in that situation, please encourage them to get vaccinated to hopefully keep them from getting severely ill next time this surge comes on. And the hospitals and the nursing home and the clinics are in the county are all following a state mandate that's come out for healthcare workers to be fully vaccinated by September 30th. So this is a big deal. The state has mandated that the healthcare workers in the county at these sites, clinics, nursing homes, and hospitals all get fully vaccinated by the end of September, or they are not allowed to come to work. This is probably going to lead to some staffing issues in the local hospitals, but it was felt at that level that this was the best way to protect the health of the communities. Boosters, there's a lot of questions about boosters coming up, and there's a lot of changes going on, but people with significant immune suppression are eligible. It's very specific what those groups are. And you can go on the websites of the CDC and find out what that is if you have questions, or ask your medical provider. On Friday, the FDA group that was looking at booster shots for Pfizer made recommendations that people 65 and older, or those who are at severe risk because of underlying health issues, will be able to get a third Pfizer shot in the near future. Moderna does not seem to need a third shot based on the current data, so they're not recommending that. So, and the third Pfizer shot, we're still waiting for the guidelines about that, but it looks like that's what's probably going to happen. So, I think the overall messaging here is really not much different than it has been previously. We want to increase the vaccination rate in the next couple months so that we can have a better chance of protecting the community if another bad surge comes. The van's here to help with that, but it's a limited resource. It's probably only going to be here for another 6 weeks or so. And so take advantage of it and go out and get it. We need people to get vaccinated so that the schools and the hospitals will keep going. So, we have to fight this together. It's a group effort. Preventative measures like a healthy lifestyle and a good diet are great, but this huge impact of this pandemic is requiring us to do more. And new data has come out that 1 in 500 Americans have died within the last year and a half from COVID, which is really a remarkable number. And, a lot of sadness in a lot of families around this. And so we want to try to prevent this as much as we can going forward. And there are some treatments for people when they get sick, monoclonal antibodies, remdesivir, steroids. The monoclonal antibodies is starting to get very popular now. To think about this, when people are getting COVID, and but now there's a limited supply. There's problems in the supply because the demand is so high. So the state's going to be allocating certain amounts to us, and then we'll be distributing it throughout the county. And of course, oxygen and mechanical ventilation are essential if people get to where they are having trouble breathing from it. But again, I just want to emphasize that ivermectin has not been shown by the clinical trials to be effective in the way that we would expect for a medication to use in this way. So we're encouraging people not to use ivermectin. So in closing, I just want to ask everybody to please take the steps to keep our community safe and the schools and businesses open and the hospitals available to take care of sick people, and do what you can to decrease the spread of COVID through the community and keep everybody safe. So thank you.